Hello everybody, Dr. Marianna here from SkinTock. Today we're going to start a series of talks about a group of medication called neurotoxins or neuromodulators. These are medications that basically manipulate muscles. So all things are poisonous and there's nothing harmless. The dose alone decides that something is not a poison. This is what a Swiss physician and chemist in the 1500s said his name was Paracelsus. Neuromodulators is currently the most popular non-surgical injection all over the world. 3 million injections per year is currently injected all over the world. So here in Canada, we have 4 products that's Health Canada approved. You know, Botox, the brand name that's basically become a household name that's been around for 40 years or longer. And then we have Dysport, that is a little bit different than Botox, but they all do the same thing eventually once it's in the skin. Dysport was approved in Canada in 2014. And then we have Xeomin. Xeomin is known that it works a little bit of a softer effect, and Xeomin was approved in Canada in 2009. And then we have a new kid on the block called Nucivia. So Nucivia was approved last year, and we're all still trying out to see what is the specific nuance of our new products. So the most common areas that we use neurotoxins in is mostly in the upper face, approved for frown lines or those 11s that is typically a very negative emotional connotation that people love to start off on their neurotoxin journey. But also around the eyes, nice to soften around crow's feet. I use it to lift the brows up a little bit, and then of course forehead lines, which I think after doing this for many years is the most difficult to manipulate in my world. And then some people also get these little squinchy lines across their nose when they talk. We call them bunny lines. So also a nice area to address with the neurotoxins. So for the lower face, the neuromodulators we also can use. We just have to be a little bit more careful because this is a very functional area and we have to be respectful of that. So for areas around the lip, we use neuromodulators to address those barcode or lip lines that we get as we're getting older, even if you're not a smoker. I also use Botox in the lip area for younger patients who wants to have a little bit of a flip of their upper lip. And then the other areas that Botox is commonly used in the chin. So some people get that chin irregularity or like an orange peel look when they talk, and then also the muscle that pulls our mouth corners down that makes us look sad. Those are all good areas. And then a little bit of manipulation around the neck area for the neck bands and create a little bit of a lift in this area. I also now use neuromodulators a lot in the masseter muscles, which is our chewing muscles here. And for cosmetic purposes, we use it for slimming down the face very successfully. We also have to remember that neuromodulators has been used for medical purposes for decades. It's fantastic to control overactive sweating or hyperhidrosis. Also use it for people with strabismus or eyes that's not lined up correctly. And then bladder spasms and for contractors, so children with cerebral palsy is a very good example of that. And then one of the newest things that I'm really fascinated with is there's more and more evidence that Botox improves patients with depression. So really interested to see where that further studies is going to go in that direction. That's it for today. Till next time, please stay safe, be healthy, and be kind. So before I go, I want to tell you about Lewis Capaldi. He's a singer-songwriter that I discovered a few months ago that has really impressed me. He's in real life, really funny young guy. His music is called Blue Eyed Soul, and I encourage you to go check him out. Till next time.